Good morning. All right. Next question is kind of a double question from Barb. Yeah. All right. Good to see you again, Barb. Um, Question is basically about hydroxychloroquine and does it work and all this stuff. Which, yeah, I'm of the opinion that there isn't a strong scientific consensus that it works, and there's pretty good evidence that it doesn't work. So the first part of the question is, can you post the papers that show this? And yes, I will post some of these papers, but there's different kinds of evidence, and I think that's what we've got to cover here for the start. So there is one decent sized study that does show that hydroxychloroquine may have some effect. Problem is, this is a thing called a retrospective study. And in a retrospective study, you're not saying we want to find out how this thing's going to work, so we're going to give some people placebo and some people hydroxychloroquine and compare the results. It's not like that. That's like the fairest, best test that your scientific dollar can buy. A retrospective is where doctors make decisions and they decide who should get what drug based on their clinical judgment, which is, the thing that they've trained at and that they're pretty good at. Yeah. And so for some patients, they will prescribe hydroxychloroquine. For other patients, they will not prescribe it, either because, yeah, well, for the reasons that are known only to them. But it may be that they would not give this to somebody who's in very serious shape because other chloroquine-like drugs have been known to damage, like the liver, a little bit, and so there's a chance of toxicity there. And we know that hydroxychloroquine is associated with, I think, detached retinas, something bad like that in your eye. That's a like higher than average side effect. Not common, just a thing that can happen with this. And so, yeah, the retrospective study shows it may work, but being retrospective, it's kind of a combination of what happened and the doctor's judgment based on what they thought was going on in the patient. So, of the people that they gave hydroxychloroquine to, they came out better. And there are reasons to say that if you think that it's something is treatable and you go in and treat it, they may have some instinct that somebody is going to pull through or needs extra attention and help. And there are ways that this can work that have nothing to do with hydroxychloroquine. That's what I'm saying. The prospective studies, that's the ones where you placebo controlled blinded prospective study. That's like where you say, I'm going to test out this thing, and then you go out and test it, and you don't know whether a person has got hydroxychloroquine or not until after the entire study is over, and then you go back and see who did well, who did badly, how many died on each side. Those studies are the ones that have not shown any effect of hydroxychloroquine. So the only time we have seen hydroxychloroquine have an effect is when a human's judgment is in the loop and is helping to determine who gets hydroxychloroquine or not. When it is randomized and controlled properly, so far I have not seen any good, solid evidence. So I can put the papers up there, but that's gonna be the comment if you go and tell anybody else about them. Like, yeah, there is this other. It's got 2,000 people in it or something, if I remember right. So decent size, but yeah, compared to the other papers from China and the U.S., there is just not a solid body of evidence, and essentially all the rest of the world has realized this and moved on, and it's only in America, for reasons that I think are all tied up with politics, that we're even considering this as still something that's viable. Um, Behind this little screen, I've got about 100 tabs open, and about a third of them are new kinds of drugs that seem to work in animal models and are protective, and new vaccination strategies. There are really a lot of things to try, and I just don't think there's any value in beating this particular dead horse any more than it's already been beat, when there are probably much better answers, and we got to test them. And there's only so many people that have COVID. There's only so many doctors that can do the tests, and so yeah, we're limiting the chance of success by focusing on things that haven't worked and just staying fixated on them. There's so many other choices, and yeah, that's where I would like to see the debate go. And I think most of the people that know what they're doing are looking at picking out some of these things, are just hearing about these things, or saying, "Wow, let's try them out." Because we've got through breathing hot air, which kind of went away, thank goodness. There was a while where people were saying that smoking is probably going to be protective because it wasn't showing up as being particularly bad. But now we have good studies in that show that smoking does not help you with COVID. And you think about it, you say, well, why would it? Why would we ever think otherwise? So yes, one of those situations. Yeah, I don't know. Once you learn a weird name like this, and it's like embedded in your conscience, I just feel like people want to get some mileage out of it. They learned this stupid hydroxychloroquine, like yeah, almost nonsense letter name, and yeah. But that's the thing. In science, if it doesn't work, you got to let it go, and you got to move on to the other thing, the next thing, whatever it is. Keep trying. That's the key. That's how we get out of this. So there we go. Thanks very much. This has been Ask Dr. Ben.